Is there anything that demonstrates the promise of the future more than a newborn child?
Seeing a newborn baby is something that fills you with so much hope.
There's nothing more heartwarming than looking into my son's eyes.
Your baby is healthy. 4 words every parent longs to hear. At hospitals around the country, babies are tested for many diseases within the first 24 hours of their birth by what's known as a newborn screening test. A test that will mark its 50th anniversary in 2013.
The newborn screening test is a test for about 50 inherited conditions.
Early detection is vital to ensure that children receive the kind of timely intervention which will prevent disability or possibly even death.
They prick the baby's heel, wipe away a little bit of blood, and then drop several drops of blood on what's called a filter paper card. And the blood is dried thoroughly and then sent to the laboratory for analysis. We generally get those within 1 to 2 days after collection.
In support of an Iowa Department of Public Health program, the State Hygienic Lab at the University of Iowa conducts newborn screenings for babies born in every Iowa hospital. The lab also conducts newborn screening for babies born in North Dakota and South Dakota. Erin O'Gara is a doctoral candidate at the University of Iowa School of Journalism and Mass Communication. In 2012, O'Gara, with the help of a grant from Genetic Alliance, partnered with the State Hygienic Lab to produce an educational video for hospitals to help ensure proper testing for every newborn.
Ultimately, our goal is to reduce the number of invalid specimens and help the greatest number of babies who can have identified disorders receive the treatment and care right away.
Through focus groups and surveys performed while researching the video, O'Gara discovered the key ingredient to an accurate test was communication.
It was really amazing to see the connection between the laboratory staff on our end and the nurses and phlebotomists who are collecting these specimens from Iowa hospitals.
And this is where it all begins. So what happens?
We wanted something that was going to feel like it had a question and answer kind of format.
Once a blood spot specimen is collected, does it need to dry before being sent to lab?
Yes, it needs a minimum of 3 hours for drying time.
There is a right and a wrong way to collect a newborn screen, and we hope to try to spread the word, and I think this video is a good tool for that, of the right way and the right practices in collecting.
O'Gara's informative video was released in 2012, and thanks to social media, has been seen in hospitals throughout the country.
So far, we've had a great reaction from other hospitals. We've been trying to disseminate the video as much as we can to hospitals around the country, and then to encourage staff members and directors of neonatal programs within those hospitals to sort of pass it on to their staff.
Having this information out there about the best way to conduct these tests ensures that we're getting the most accurate results we can for newborns in Iowa and the Dakotas.
Every year, more than 12,000 babies in the United States receive a positive newborn screening test for various conditions, emphasizing the importance of Iowa's informative video.
There was nothing more devastating than learning my son was diagnosed with biotinidase deficiency. It's very rare. I believe it's 1 in 137,000 births have what he has. Symptoms could be something from losing hair, to losing vision, to losing hearing, to coma, to death. Because we caught it early, he has no symptoms. He simply takes a vitamin supplement every single day and will the rest of his life.
To know that his disorder was recognized through our screening program in Iowa and that he is now going to lead a very healthy, long life is something that is really kind of indescribable.
It is so crucial because that simple test allowed our family to live a normal life and allowed our child to be healthy.
It reinforces everything that we're doing, and it's just exactly why we need to work so hard to keep the quality of Iowa's newborn screening program as high as it's been.
It's neat to see a university in your state investing in children who live in your state, children in Iowa. So I couldn't be more proud.